Okay guys, it's Dan again, and in this next part of the correcting ankle dysfunction series, we did the release techniques in the previous video. So we looked at the static releases and the active releases for the gastroc and soleus muscles. So once we've done that, we've got them out of the way, we've calmed those muscles down. What we need to do then is mobilize the joint. What I will say, if there's anyone out there who is hypermobile, if you've been diagnosed with hypermobility, don't do these techniques. These are contraindicated. We don't want to make you more mobile. That'll make things worse. So if you are hypermobile, don't watch this video. Okay, cool. Got that bit out of the way. So this next part, like I said, we're going to be looking at mobilization techniques. Okay, so with the ankle joint, with the foot, I've got a little model here of the foot, and this bone right deep in here, I don't know if you guys can see that, this bone here, that's your talus bone, and that just, as you can see, it's kind of wedged between your tibia and your fibula on top. These ligaments are in the way, so it's a little bit difficult, but it's right in there, and it kind of sits between. It's kind of, you've got this is the ankle mortise, so you've got the fibula, you've got the tibia on top. It's kind of like a block, and then in between you've got like this little kind of cuboid kind of muscle, or rectangular kind of muscle, bone I'm on about, called the talus, and it projects outwards slightly, as you can see. What happens there with the talus is it tends to actually shift forward, and that creates like this bony block. So if I went to do a squat, if I squat down and I can get stuck here, sometimes people will actually feel a bit of a pinching in the front of the ankle there. If that's blocked there, I can't actually move. It won't actually let me move my tibia any further, because it's almost like a doorstop. It's kind of, because it's come forward, because it's projected forward anteriorly, I can't actually get it any further, and that causes problems. That really limits my range of motion. Even though I've done my release techniques, again, if that's still there, I can't get any further. I can't do any stretching techniques because that's still going to be in the way, so I'm not going to get much effectiveness if I don't mobilize this joint. So as I said, as it's come forward, what we need to do is we need something that's going to help to glide it back into place. So then that will allow my knee to go further, my tibia to translate further over my foot. So how do I do that? Well, luckily we've got some tools that help us do it. You're going to need these thick bands. I'm actually going to use a green band here, so I would use a thicker band. Maybe you might be alright with a red one. I'll probably say the black one upwards should do it. Black to green should be absolutely fine. You're also going to need to elevate your foot. You need a chair. I've actually got the world's smallest chair. This is actually my kid's chair. But make sure it's stable. I'm going to hope my foot doesn't go through it. It shouldn't do. You're also going to need something to lean against, so again you could use your foam roller. But what we're going to do, it's real straightforward. None of these techniques are complicated. You're going to get your foot in the band. So move that roller out of the way a sec. And we're going to put the foot up onto the chair. So I've got a bit of a downward pull, a bit of a diagonal pull downwards from the band. I'm going to make sure that the band is right. The band's just going to tuck in underneath these two big bony bumps on the outside of your ankle. They're your lateral malleolar on the outside and your medial malleolar on the inside. If you know your anatomy, then I'll start talking. You guys know that. So the band's going to sit just underneath that. That way I know that it's going to be putting pressure on my talus. So once that's in position, I need to make sure that the band's nice and tight. Once that's in position, it's going to give us a nice pull backwards this way. What I need to do to get that pulling motion is, I'm just going to move it along this way so you guys can see a bit clearer. I've got the foam roller here, that's going to help me help keep me upright. Got lots of tension on the band. I'm going to keep all my weight on my back leg, so I'm mobilising my right ankle. So I'm going to keep all the weight on my left leg. And all I'm going to do is I'm going to use my hips to push my knee forward. And what I'm doing, I'm pushing my knee forward over my foot It's creating a bit of tension in the band, and that's going to start to mobilize and oscillate my talus backwards or posteriorly. And what I'm doing as I'm doing it, I'm just making sure that my knee is translating over my second toe, and I'm going to be doing 1 to 2 oscillations per second. So an oscillation is that's an oscillation, one movement. So we're going to do 30 seconds to a minute at this speed. Again, making sure that I'm not compressing my right foot, I'm not leaning forward, keeping all the weight on my back leg, just pushing through my hips, pushing my knee forward. I'm making sure that my heel is down. I'm not letting my heel come up. I'm not trying to steal range. I'm just working with what I've got. And don't expect to feel much when you're doing this, guys. You probably won't feel anything. You may feel some relief when you're doing it if you do have that pinching feeling in the front. So there's a few things I can do. I can kind of just work up to that kind of point where I can't go any further, or I can go forward, go right up to the point and just do some smaller little oscillations there. Again, 1 or 2 per second, and just really work on that end range. Okay, or again, I can just do the larger amplitude ones, going up to the point and back. Okay, so again, just 30 seconds to a minute, and that's all you'll need. And again, that will start to really pull that talus, like I said earlier here, it will really start to help drive that backwards. Okay, so all you need is a band, a chair, something to lean against, and we're all good.